Welcome to this webinar on head and neck collars for people with motor neuron disease. My name is Orla Foster. I am a clinical specialist occupational therapist in Beaumont in the M&D clinic. Today, I'm going to talk about a little bit about the service, just for people that might not know about the motor neuron disease service in Beaumont. I'm going to talk about head and neck issues that are very difficult for people with motor neuron disease and difficult to solve and have a solution for, a perfect solution for. I'm going to talk through the considerations when using collars and the types of collars that I would commonly prescribe and when to use them. Just a bit about the Motor Neurone Disease service. So we are a specialist service. We have lots of expert staff, and we were previously more of a clinic, just a clinic rather than a service. So that's been a change over the last couple of years. It's a full service. So it's always been a clinic day on a Thursday, a long, busy clinic day. But now, because we have so many staff, we're all providing a bit of outreach service as well. So we have, I suppose, on the team, we have myself, the OT, physiotherapist, speech and language therapist, we have a dietitian, we have neuropsychology, we have social work, medical doctors, research specialists, and we have lots of advanced nurse practitioners and clinical nurse specialists. So we have a really huge team, and we're very lucky to have a lot of expertise on that team. So as I mentioned, the clinic day is on Thursdays, and there is both ourselves and from clinical, and there's research professionals from Trinity on that day in the clinic every week. I suppose from my perspective, in terms of the outreach service I provide, I've definitely been working on what this looks like and how this operates since I started last year. But I would do home visits if there's any kind of specialist input needed that a therapist in the community needs help with. So things like the collars, or if there's any kind of advice around, I think I've been involved with some home mods and things like that if people need advice, but it's very much a work in progress as to what that outreach service looks like. I have been providing a lot of support to nursing homes, and because nursing homes are a grey area in terms of access to therapy and occupational therapy, so I have been filling gaps there as well. But I'm very much open to facilitating and providing support for therapists in the community in whatever way I can. I guess something I've learned over the last year is that although I can be as helpful, I guess, as possible, I can't take over the full role of being that primary care OT, because it becomes too busy. So sometimes I have plugged gaps for situations where the primary care therapist hasn't been available. But unfortunately, with the level of input, as you would know, that's needed, it's kind of impossible for me to keep up that level of support for that person. I have been providing a lot of education around the role of OT with M&D as well, and I've done a lot of training and presentations to that in that regard. So I'm open to that as well. So if anyone needs any support, I'd be happy to do that. So just again about the clinic. So it was previously only a nurse and doctor led clinic from 1994 onwards. So there's been huge changes in what the service can offer. So it's been exciting over the last couple of years. Well, I've just been there over a year, but it's exciting to see that there are changes, and hopefully they will continue to improve and to make the service as viable as possible for the MND patients. We are linked closely with IMNDA, so we always have an MND or an IMNDA nurse at our clinic every week, and we would talk with them all the time because they tend to be out on the in people's houses, and they would link back in to give us updates. So it's a really good link to have, and as you would know as well, they have all their equipment and resources that we access when we can from them. So yeah, so that's kind of the service in a nutshell. In relation to head and neck collars and problems, you know, they are so difficult. It's really difficult to manage a head and neck problem once it gets beyond a certain stage. And it's important to acknowledge that, because it can be very, I guess, soul destroying in a way to not be able to help your patients to get the best solution that they need and that, you know, that would help them. So it's a constant work in progress to try and see what we can do to alleviate them from their pain and discomfort, and to help them, I suppose, live their life in the best way that they can despite the neck problem. So it is a challenging area of work, but it's definitely worthwhile taking the time to find out what works for the patient, but also constantly be reevaluating that with that patient so that you know you can offer more advice and support as things change and as they go along. And if something's not working, that we are available to help them to problem solve what other options they might have. It's so important. I've just put a note there whose role is it physio or OT. So I think certainly I do it in Beaumont, but I know that when I worked in a previous role in Australia, the physios tended to do all the hard neck collars and the OTs did the soft ones. And there was no reason other than that was a long-standing cultural thing. So I find with my experience now, I find it's very varied. So it depends really on who feels that they are skilled to do it or who's open to doing it or where it's fallen just from here's his historical kind of input. So my kind of opinion on that would be that we all have the skills to do it. It's just a matter of learning a little bit of new information and being, I guess, courageous to actually try things out and to see what works and what doesn't work. And again, I'm happy to talk through any of the situations with, if you've got a patient and to talk it through, because sometimes even just having that conversation with another person and talking out loud about it and problem solving with another therapist can be really, really helpful in making decisions around what's possible to try. So collars, they're really useful for people with motor neuron disease because they help support the weight of the head, and it can improve comfort and the person's ability to perform their daily activities. But it's sometimes difficult to predict what's the most useful to do. So that's where experience and trial and error comes into play. And I'll talk a little bit more about that further in the presentation. I think that the collar situation can be tricky in that, it's not a nice thing to be wearing a collar, and nobody wants to have anything around their neck or impinging on their ability to communicate, or even just the discomfort of having something close to the area where you swallow food and breathe. So it can be, I always tread with caution when I'm recommending a collar. We often, I know from my experience in the clinic, oftentimes the medical staff will say, oh, they need a collar, but the collar for me is probably the last thing I'll look at. I will definitely look at it, but I'll try and see if there's anything else that they can do before we look at getting a collar, just because I know it's so significant for a person to wear a collar, and they're not always the perfect solution anyway. But one of the kind of reasons why sometimes patients don't want to wear collars as well is because they are afraid that it'll further limit decrease their muscles, and that's not going to happen because their muscle wastage is happening from their disease, but also they they only wear collars for certain activities and certain times of the days. It's very unlikely they'll wear the collar all the time, and even at that, it's not going to cause their muscles to waste any further. Usually by the time they're using a collar, that wasting has happened anyway. There is maybe some merit in thinking that you could shorten the muscle and stop that muscle from moving, but if we're carefully considering when we might input with a collar, it's not really an issue. And the collars aren't going to replace the muscles either. So I think that's a kind of a misunderstanding as well, is that it's going to, it's not going to do the job of the muscles. So it is going to help, but it's not going to do the job of the muscles. So just another important thing to note. Some of the considerations with collars are, as I've said already, there is no perfect solution. Early intervention is key. So as soon as you meet a person with MND, I would be asking the question, do you have neck pain? Do you have neck discomfort? Do you have any tightness in your neck? And this is so important, because if we don't ask that question early enough on, and maybe they're so consumed with other issues they haven't even noticed, and this is the time to get them thinking about what's happening with their neck, because this is the earlier we can have input with their neck, the least severe the problems are likely to be. Because if a person has muscle tightness or a little bit of discomfort, but you can manage it with exercises, or you can manage it with a heat pack, or you can manage it with positioning in their chair, then they are going to be already helping themselves from getting into positions where their muscles have got too tight, or that the pain is so severe, or that they develop contractures. So it's really, really, really important to address it as early as possible and look at the options, as I've just mentioned, what they can do before they use a collar. So heat packs are brilliant because it really loosens up that area for exercise. And then exercises, simple exercises that people can do are moving their head to the left and right and holding it for 10 seconds on the left and holding 10 seconds on the right. I've just done the wrong way there, but and then lifting your head up towards the ceiling and having that stretch. There are exercises they can do in lying, so they can do that when they're lying in bed in the morning time. They could put a heat pack on, then they could do their exercises, and they could do that several times during the day. The other thing that would be important to note is with their different activities of the day. So, for example, if they're getting out of bed, maybe that's the start of their difficulty. So maybe they do their exercises and then their heat pack in the morning time. Then they get out of bed. Maybe for the transfer, they need a soft collar. They might not, but just explore the possibility if that's a hard transfer because of their neck heaviness and pain, that maybe the soft collar would be a nice collar to use at that point. You'll notice with MND patients, they might be getting their partner to hold their head if they can't do it themselves, or they might be holding their own head with a hand. So a soft collar might replace that need for that, and then they might have their hands free to actually do the transfer. So something to consider with the transfers. Sometimes people use, if they're in a hoist and they're being hoisted, sometimes they use a soft collar during that time as well, because it gives that little bit of support and makes that transfer just a little bit more secure for them. So again, something to consider. One of the best solutions for head and neck pain and discomfort and positioning is using a recliner chair. Obviously, a person's not going to spend the whole day in the recliner. Maybe they will, if depending on where they're at in their disease or how much fatigue they have. But the recliner chair is perfect. It gets you into that position where gravity is supporting the head and they feel comfortable, they're relaxed, they can still see around the room and communicate and interact with their environment and their people that are with them, but they're completely and utterly comfortable. So really consider, if they don't have a recliner chair, consider that as a hugely important recommendation for them, because it's often the best thing that they can do. And having that chair and knowing that even if they've got discomfort at other times of the day, but they can know that they're going to have that safety and comfort when they get back to their recliner chair, is just worth its weight in gold. Another consideration is, which I've mentioned, the heat pack, but do they need a massage? So depending on what kind of muscle tightness they have, they might benefit from a massage. Where is that muscle tightness coming from? Are they using compensatory muscles then in their body because their neck muscles aren't working well? It might be an idea to consider looking at a professional massage. And it can be a way of looking at the person's whole approach to the person's relaxation and well-being. So, you know, if they're fatigued, if they're have muscle tightness, like it can be something really, really useful to consider. And IMNDA do have a holistic grant for massage and acupuncture available, so it is something that I definitely consider with some of the patients from time to time. And do they need, I've already mentioned the exercises and stretching and the type of exercises that you might do with a head and neck issue. I'm going to go through the different collars that I most commonly use, and I will just talk to them and give you the reasons or the times that I might consider using them. So the soft collar is the most simple collar. It's the easiest one to begin with. It's the cheapest. I think they're about €15. They're available through Murray's and chemists. Most chemists have them, and they're very simple. I find that they can be useful as a starting point, and sometimes people will use them during traveling in a car or just giving that little bit of support that's needed. And I've just mentioned about hoist transfers before. They can be a good one to use for that. Times when they're not tolerated is if there's too much pressure on the throat from them or the swallow is difficult, and the height of the collar must be considered so that you don't push the head into extension. And I'll just show you here the bit. This is the bit that goes under the chin, and sometimes you might need to consider making that smaller, so you can use a tape to tape it down if it needs to be made smaller, or you can cut it down if needs be. So I would often consider using a protective material on top of this to keep it clean. So it is called stockinette, And I think I thought I had them here, but I usually cut off some of that and give it to the patient so that they can wash it easily, and that it keeps it clean, and it's much more hygienic to use that stockinette with it. The headmaster collar, again, this is quite, I suppose, commonly used with people with motor neuron disease, and this is much more, I guess, rigid, we would call it. It does hold the weight of the head better than the soft collar, due to the nature of its rigidity, and it can be amazing for some people, but it can be awful for some people. So the chin is supported with a pad, and then there's a piece that goes underneath the or onto the chest, as you can see in the picture there, and it's a really good collar, but the difficulty for it is that if you've got breathing issues or you feel compressed in your chest already, then it's going to further compress your chest. It does have an opening here, which can be nice for people that don't like that claustrophobic feeling around their throat. And it tends to, so over time it'll fall down because of the weight of the head, but it can be opened back up again. So it might be good for someone who's walking and who needs that head lifted for walking, and it can be really useful. And I wouldn't recommend eating with it on. I think that sometimes people have tried that, but I would mostly recommend trying to get positioning in a chair done right, for feeding and for eating, and to talk to your speech and language therapist colleague about the swallowing and their ability to swallow safely. But I wouldn't recommend using that for eating. This is the Hensinger collar, and IMNDA don't do these anymore. They do the soft collar and they do the headmaster collar. I think this looks like a bit of a life jacket, and it's a really expensive collar, even though it doesn't really look like it should be that expensive. But it clips at the front here, and it's a bit rigid on the front, but the rest of it's soft. And again, the usefulness of this depends on the person. The most useful I've seen it being with patients is when they've been quite, I'd say when their body is quite flaccid, when they have a lot of muscle weakness, not tightness, but weakness. And it's been good for people in recliner chairs that needed just a little bit more support and weren't getting exactly that from the chair, or they needed to be a bit more upright in the chair for breathing. But this collar helped them in that way. So I've had a few, and sometimes people in bed, because it's soft enough to be in bed. But again, for someone that maybe needs to be a little bit more upright in bed, and then their head's falling forward, so this kind of thing could be useful for that. The head up collar, this was specifically designed for people with motor neuron disease. It was, I think it was in Sheffield University that it was developed. Personally, I'm not mad about this one. I find like there's been some people it's worked for okay, but it's very close. So it's that kind of a neoprene material, and it's very close. It has to sit very close to the neck for it to be work well, and it's it then uses these different pieces of material which can be heated up and bent into place, and it could be useful for someone that's already fixed into a position already, and it's in an unusual maybe position that needs to be supported by the the ability of the pieces to be bent into shape. But again, for people that are claustrophobic, don't like things too close to their throat, it might not be the best idea. But the principles of it are really, really good. But the reality of it for me hasn't been that successful. But with MND, it's always really good to have options, because there'll always be one or two people that something works really well for that might not work well for the majority. So the Miami J collar, you probably are familiar with this from when people have spinal injuries, or the first thing that is put on a person when they've had an accident is this type of Miami J collar. It's not great for people with MND, in my experience, but sometimes it works with an adapted version. So maybe having the front of it with like a strap around the back, so that it's supporting the head but not as severe at the back. The reason why it's not that comfortable or not that good because it's so rigid. Like there's no movement really, and that's what it's designed for, is to not have no movement. But for MND patients, that can be a bit severe. I did have a patient who had other things going on. So she had her neck weakness, but she also had severe pain coming from her shoulder, which was just chronically, severely painful. And the only collar that worked to alleviate her pain was the Miami J. So like everything else, you know, for her, honestly, was the best thing that we could find. But for most people, it's a definite no-no. So don't rule it out completely, but it's you know, more often than not, it's not going to be the one. But as I said with the last few, is that there's always one person that, you know, has different things going on, has comorbidities, or has different issues that it might benefit from. This is the Bragg Pinnacle collar. I like this. This is different. It's similar, it looks similar to the Miami J, but it's more flexible. So I'll just show you it here. Looks quite similar, but the difference is, which is really good, you can change and adjust the height for one size fits all, but you can adjust the height using this this button here. And the good thing about it is that it's much more flexible than the Miami J, so your chin actually can move up and down with it. So people have eaten with this one on, and I think it's good. It's not that expensive. I think it's about €50. It's available through Beagle Orthopedic, who are in the UK, and again, not for everyone, but really, really good for some people. And I find it good for people who are still walking but need their head supported to continue walking. I find that it's been good for that. The head loft is a strap for around the head. This is for use with wheelchairs. I've had a patient who's used it in the car because one of their things they want to do was pick up their child from school, and they were able to use it with the headrest in the car to keep themselves sitting in a position that was safe to go and do that school run. So that was really nice. I've had people using it in wheelchairs where, you know, their head's starting to go forward, and the only thing that will bring it back is having the strap around the head, because, you know, even though the around under the chin is useful, biomechanically it makes more sense to hold the head up from here. Obviously it's not ideal, but it's like it is just much more you know, you're holding the weight properly if you can hold it from there. But obviously it's not practical in many ways. But yeah, the head loft is available through O'Neill Healthcare. It's, I think, about €500, and yeah, 511, and it's good for severe head weakness. But again, like all this stuff, we need to be kind of assessing as we go along, and we need to be flexible in our approach to this, because if someone's already fixed in this position or the other way, it's very hard and painful to get them back up into the upright. So we have to be realistic about our expectations. So maybe the goal is not to get them the full way up. Maybe the goal is just to get them up a little bit so that they can see around them, or that they can communicate a bit better. Or maybe if they tolerate that much, then after a while you can gradually get them back up into a more upright position. But it's important to note that it might be unrealistic if someone's already in that fixed contracted position to get them into like a more, we'll say, a typical upright normal position. So again, that's why early intervention is so important with necks, so that we avoid that neck getting contorted like that. So we as occupational therapists and physios need to be inputting all the time on this, not just leaving it, not just, you know, giving the advice. I find myself giving advice to people about their head and neck, like from day one, where I just say, I kind of just tell them, you know, we want to avoid anything severe happening, because it's just so awful for a person to have their head and neck in that position, along with all the other issues that they have with this disease. One of the things that you will indicate the need for this collar or this head support is that you'll start to hear that families will start doing things like tying a tie around the person's head on a chair, or, you know, using something like that to keep their head up. And that's because they have no other option. They're like, what will we do? And they will use a tie or something, which makes sense, because they want their family member to be comfortable. And when they start doing that, this is where, obviously, if you can identify it before that, it's good. But if they start doing that, you're like, this is the type of the collar that they really are looking for, which is obviously the more medically sound and safe way to do it, is to use this collar rather than the tie. But you can understand why people will resort to doing things like that. So this is the Beagle Head and Neck collar, and it is, I'm just grabbing it here. It is or I believe useful for people who are still walking, but their walking has been limited by the inability to hold their head and neck up. So their legs are strong, but their head and neck is weak. And it's really, I suppose, it's worth, I guess, maybe preempting or giving the information to the person before you show this brace to them that it is a bit scary. So this is a bit scary for someone to look at, that they're going to have this whole contraption on them. So I think part of our job as therapists is to introduce things in a way that makes people feel more comfortable with the possibility of it. So I will always say to patients before I introduce this that, it's it can look a bit cumbersome. It is, it's not ideal to be wearing this, but it can make all the difference in prolonging their ability to walk. And another consideration with using this is if the person is, if you actually identify with them that like walking is part of their, like, not just, obviously we all want to walk, but if they go for a walk, if walking is part of their life, like they tend to go out for a walk every day, well, this is something that would really optimize their ability to do that, if it works for them. So it has a strap that goes around the head. It has a spinal support, and kind of straps like a bag, like a backpack. And then it has a pelvic strap as well. It's actually quite comfortable for people when they put it on. They like the feeling of having the contact in many different areas, so it spreads the load. And so that's really nice for patients. But the strap around the head, it does hold the weight of the head quite nicely, but again, it can cause redness on the head, so it has to be done gradually so that it's not causing like an actual indentation in their head, or it doesn't cause any skin breakdown. And it, again, you have to be realistic in what your expectations and your goals are for this. A person's not going to wear this all day long, because it's not going to be comfortable to wear it all day long. So it might be that they plan their walks and they put it on for their walk, or they plan different things and they use it for that, but maybe they use other collars at different times. Everything, it's amazing for some people, but it doesn't work at all for other people. So I'll give you some examples of using this now in a moment, but this brace is €850 for the Beagle team to assess for it and supply. And now myself and some other therapists in the community are learning how to, or have learned how to assess for it. So we are inputting, and then it's cheaper for the brace because that assessment piece isn't being done by the company Beagle. So just to give you a little bit of information around access to collars, so IMNDA will provide collars to therapists who have assessed for them. So if they get an assessment and a recommendation from a physio or an OT, then they'll provide soft collars and headmaster collars, which I mentioned and showed you earlier on. I have got collars and I am able to send them as a backup option, and I believe that whatever it takes to get the MND patient sorted out as soon as possible, we need to do that. So I suppose I would recommend, though, if you are, say, getting one from me, that you then apply for the collar through the person's medical card, so that you have then a replacement piece for yourself, and just to start having a few in stock for yourself as well. The funding for the Head Up Beagle neck brace, that's something I've been working on, is to figure out how to do that. So some of the HSE RAG funding has been provided for that, and also VHI and other private health insurance can also fund it. So there is some information that I provide for the patient, so that they have the language to ask for what they need with it. So I'm going to provide that along with this presentation as well, so that you have it. And some of patients are privately funding it. So if it works for a patient, you'll notice that they'll just be like, I'll pay for it. I don't care. I just want it. I need it. Get it for me, like ASAP. So, but obviously we want to advocate for the patient as much as possible. And I think even if a person says they'll pay for it, it's really worth exploring the other options, because we need to be the ones that are making these things possible. And if we don't highlight the need for them, then nobody knows, and it just becomes a grey area and it doesn't happen. So I think we always need to go back to our managers and ask the possibility of funding. We always need to be checking with them about their private health insurance, and kind of private health insurance will try and say that they don't do things, but if you push a little bit and they have the right information to back it up, then they sometimes then agree to it. So And also, IMNDA aren't funding this. I've asked them, but I sometimes think it's still useful to ask the question so that the question has been asked, so that whenever they revise their potential funding opportunities, that maybe it'll be something they consider. So I think we always just need to be putting the information out there, even if we're getting pushed back, knows, then at least there's a need being highlighted regardless. So that's my approach to all this type of thing. So going forward with head and neck collars, I think that we need to be collaborative in our approach for the best outcomes, because I am here and willing and open to supporting whatever I can, but I can't always follow through with every single MND patient because of the level and volume of patients that come into the clinic. But I certainly try my best to do what I can. But if OTs and physios in the community are willing to work with me or at least follow through with some of it or do whatever parts they can, then it really means the patient can get what they need. And I think we will develop a more flow with it, the more collaborative we are with this. And I think as I said, we need to advocate for HSE funding, even if we're being pushed back, which I get a lot of pushback. But again, we need to be highlighting what's needed regardless. Early intervention is key. I can't stress this enough. Please talk to the patient about it as early as possible. Talk to them about exercise. Talk to them about heat packs. Talk to them about massage. Talk to them about caring for their head and neck in the best way possible, because unfortunately I've had some patients that ended up in really contorted positions, and it's really sad to see, and it's really, really hard for the patient. And just check about VHI or private health insurance to make sure that they're not, because a lot of people forget that they have access to that, and it's actually an opportunity to actually use it. I'm just going to talk quickly about a few case histories in relation to the Beagle Head and Neck collar, because I think it's the newest one I've been involved with. So I think, and I suppose it's quite significant, the type of support it provides. So I'll give you some examples. So I have a 72-year-old with upper limb onset MND. He's been very difficult to engage with about using a collar from the onset. He doesn't like disability equipment. He doesn't like anything that signifies disability to him. He had a lot of weakness in his trunk extensor muscles, and his upper limbs were very flail, and he was putting a lot of pressure on his lower back the way he was standing to kind of compensate for his head and neck weakness. So he was really far back, hyperextended head and neck, and unfortunately his head is becoming very flexed forward and rotated to the left side. You can see from these he's quite flexed and rotated, and you can see in the third picture how he's kind of leaning back into that lower back, and that was causing him a lot of pain. So this brace was probably the only thing that he was hopeful for. It was useful for a period of time because he was continuing to walk, and this is what we really wanted to work on with him. But really, he could have benefited from it 6 months before that. I don't think he would have been open to it even if I had access to it, but I didn't have access to it then. I was trying to get it over from the UK and it wasn't happening. So look, he wasn't accepting of a lot of things anyway, but he could see himself that if he had that 6 months earlier, that it would have really improved his quality of life, and his was VHI funded. I have another 79-year-old man with MND, farmer, active, strong legs, showing sign of weakness in his upper limbs, but not significant. He had a bit of discomfort around his neck. It wouldn't have been very obvious that this was the case, only when you're talking to him and asking him. He didn't have any tightness in his neck, but he had head and neck discomfort worsened as he fatigued during the day, which will often be the case. People go through the day and they're okay, but as the evening comes, they get really, really tired, and their head and neck is the first to go. So this is limited in his ability to walk, and he just generally felt fed up. So this was brilliant for him. He was like the perfect candidate because didn't have tightness in his neck, got him like straight away, like got his head and neck supported. And it wouldn't have been very obvious the difference, but when he had a walking stick, and whenever we could change the walking stick, we could like adjust the height to higher, because he became more his actual height rather than being bent over. So this was good. The OT involved, like, it pointed me in the direction of RAG funding. She supported me in that, and we got it pretty quickly, and it all worked well, and it's made a massive difference to him, and he goes out in the farm and walks, and he's happy. So I know another lady we had, so this was introduced to me by an OT in Galway, and she just identified that this brace might help this lady who was fully flexed forward, like her head was on her chest. And so this physiotherapist recognized that this brace might be useful after I did a talk with them. The family were very skeptical. They didn't like the look of the brace when they saw it. But this was just, in the moment, it was very emotional because they hadn't seen their partner, or the husband hadn't seen his wife's face and smile and eyes in so long. And then when she put the brace on, it was overwhelming because she smiled and she was looking around and she was happy, and it was all really great to see and made a massive difference to her. She's walking and her head and neck weakness, and she had bulbar onset, so symptoms around the throat and the voice were her first kind of issues. And oftentimes the bulbar patients will walk, and maybe sometimes they die when they're walking. They might need a wheelchair for fatigue management, but not necessarily for muscle weakness. So this made a massive difference. I guess the challenges with this were there needed to be some adjustments made. So between myself, the physio in the community, and the company, we were problem solving on it. The challenges were around getting funding, but the physio was brilliant. She was looking into all of that on the side. And we worked really well together on that, so that was brilliant. So I have another one, 68-year-old man, bulbar onset M&D, so affecting the throat and throat muscles first. He tried other colours with varying success, and his pottery, he loved pottery, and that was his main goal, was to continue with the pottery, and like he liked to be able to stand up for that. He had some comorbidities, hernia, and he had a cancer diagnosis. Again, worked really well for him. He didn't have tightness in his neck. It worked perfectly to keep his head and neck in a really good position, and it was a very, very successful input. Again, challenges with the funding. I wasn't able to link in with the OT. I couldn't get them to kind of get back to me. So I never really, they said they'd pay privately, and I really wanted to help them out with funding, but I just couldn't seem to get any solution for that. So that is all of the talk on the collars. I hope that all that made sense, and I'm going to send on extra information around the different things I mentioned in this presentation. And I'm happy to, if people feel they're interested in doing like a face-to-face at some point, I'd be happy to facilitate that. And I'm here and available for further discussion on anything to do with the collars, the neck, head and neck collars, or anything MND related. Like, that's definitely my role, is to provide education and information to OTs and physios in the community as far as I can. So I'm definitely open and willing for that. So thank you for listening, and any questions, please come back to me. My contact details will all be in the email I sent. Thank you.